So with regard to contraindications, not everyone can safely get a kidney transplant right away. Some medical or psychological conditions must be addressed first. Now, these are called absolute contraindications, meaning that transplant isn't safe until the issues are resolved. So let's review the key ones. Number one, uncontrolled infections. If there's a serious infection going on, like a diabetic wound, abscess, active TB, your immune system is already fighting hard. A transplant with immune suppressing medications could let the infection spread dangerously. We must treat and fully clear the infection first. Number two, active or untreated cancer. So transplant medications suppress the immune system, which could allow active cancers to grow rapidly. So cancer must be treated and in remission, often for 2 or 5 years before we consider transplantation. Next is severe heart or lung disease. So transplant is a major surgery. If your heart and lungs are too weak to handle it safely, it may be too risky. We recommend further tests or treatments like bypass surgery or stents if indicated, or if it's too high risk altogether, then transplant will not be the right treatment for you. The next one is active substance abuse. So ongoing drug or alcohol abuse can lead to poor medication adherence and harm the transplanted kidney. So a period of sobriety, often over 6 months in rehab, is usually required before reconsideration. And then the next contraindication is uncontrolled psychiatric illness. So conditions like untreated schizophrenia, severe depression can interfere with understanding the procedure or taking medications properly. So mental health must be stabilized with proper care. Many patients with psychiatric conditions go on to have successful transplantation. Finally, persistent non-adherence to treatment. So if someone repeatedly misses their dialysis sessions, appointments, medications, even after support, that raises a concern about their ability to care for their transplant. So we work to understand the reasons and offer support. If adherence improves, transplant can still be considered. Now remember, these barriers are often temporary. With the right treatment and support, many patients go on to be eligible for transplant in future. So let's talk about some relative contraindications, and these are not automatic disqualifiers. They're more like yellow flags. These are factors that could make transplant more risky or complicated, but with the right support or improvement, many patients can still proceed. So the key ones are morbid obesity. A very high BMI, typically over 40, increases your surgical complication risk. There's poor wound healing and infection risk. So weight loss is often recommended before listing, and there are support programs, weight loss programs, referrals are often available to address this. Second, if patient is very frail or physically deconditioned, weak, or has reduced mobility, especially if you're older, that can make recovery harder. So physical therapy or rehab programs can help build strength before surgery. Another relative contraindication is poor social support. So after transplant, you'll need help with medications, very frequent appointments during the recovery times, and if the support is limited, social workers can help you connect with resources like home care or community services. Next is mild cognitive impairment. So mild memory problems or forgetfulness can affect how someone manages transplant care. With tools like pill organizers or caregiver support, transplant may still be possible. However, in very severe dementia, transplant would likely not be offered. History of cancer in remission. So past cancer can increase risk of recurrence with immunosuppressants. A waiting period and oncology clearance are usually needed. But transplant is still often possible once the clearance is obtained. Another one is uncontrolled diabetes or major health risks like cardiac disease. So if someone has poorly controlled diabetes or recent heart problems, that increases their post-op risk. So these need to be stabilized first with help from specialists, and then we can move ahead. If you do face challenges, we are here to help. The goal isn't to exclude you. It is to make sure that your transplant is safe and successful. These criteria aren't roadblocks. They're safeguards. We want your transplant to last and truly improve your life. If you don't have any of these contraindications, a kidney transplant is likely the best option. And let's discuss different types of donors in the next module.